Hi everyone, welcome back to Beyond Your Knowledge. Today we are going to be reviewing Trendelenburg sign, which is right here. And before we continue, I would like to share with you John 6:37. And says that all the Father that gives me will come to me, and whoever comes to me I will never cast out. So, and then the one is James 1:13-14, and says that let no one say when he's tempted, I am tempted by God, for God cannot be tempted by evil, nor does he himself tempt anyone. For each one is tempted when he is drawn away by his own desires and enticed. Well, thank you so much for listening, and now we can move on to Trendelenburg sign. Well, it is interesting because Trendelenburg sign basically it is a sign. Yes, because as it said. So sign is something that we can see, okay? So, and I'm going to just mention here the sign is something that you can see, and the symptom is something that the patient feel, but we don't see. We can see. Okay. So, but this Trendelenburg sign, it is a consequence of a nerve which has any damage, and now we are going to enter to talk a little bit more about this. Okay, so basically the patients can present with damage or an injury, I think this is the right word, an injury of the superior gluteal nerve. Okay, so the superior gluteal nerve. And so remember that nerves is going to be in your nerves is going to innervate your muscles. And now I would like to show you a pictures of the superior gluteal nerve. So here is the picture. Let me just a little bit small the size here, and then yeah, probably that's fine. So here we can see in this picture, and you can see here, this is the superior gluteal nerve, which is this one. So, and this one is going to innervate the muscles, and I'm going to show you the pictures of the muscles and eventually. But yeah, so I just want to first show you the superior gluteal nerve is right here. Okay, so now let's just move on. Now this injury of the superior gluteal nerve often caused by pelvic trauma. So because if you see, this is the pelvic area here, so I'm going to do this, all this is the pelvic area, and now if there is an injury over there, the superior gluteal nerve can be affected. Okay, also, or could be iatrogenic, so that happen for any reason, but I mentioned that could be iatrogenic, the other cause. So I'm going to write it here. So pelvic, I mentioned before, pelvic trauma. But I mentioned that iatrogenic could be for any reason. But as we know, when the something iatrogenic happen, is because the physicians or the therapists, so it is involved. So basically, if there is an activity of the physician or the activity of the therapy, so this can cause by any medications or by a physician. So if the physician is doing any surgery, or if the physician is putting any anesthetics or something, so and then you go to that superior gluteal nerve, so this superior gluteal nerve can be injured. Okay, this is basically iatrogenic. So, but that can apply to different things. Not necessarily have to be in the superior gluteal nerve. So there are so many causes that could be by the physician medications in different diseases. But well, let's just move on. So basically, yes, also iatrogenic, another thing is a hip surgery, which is important, so which is very common, hip surgery, or if you are putting an injection, as I mentioned before, so, or buttocks infection. Okay, so not infections, injections. So I hope that I was right the first. Now this superior gluteal nerves is going to innervate some muscles. So what are the muscles that is going to innervate? So let me just write it down here on this corner. So the muscles, it is the gluteus. Okay, so it is the gluteus medius and and the gluteus minimus. Okay, so the gluteus medius and the minimus. So all okay. So now this is important. And also one more thing is it is the tensor. So let me just right here. So it is the tensor fasciae latae muscles. Okay. Whoa, you say what is that? Tensor fasciae. Okay. Latae muscles. I think also for those that they speak Spanish as well. So this some of the vocabulary of anatomy, they come from Latin. So for those that speak Spanish, probably this is more easier to understand. I mean, it is fine. So in language, English is good too, but it is pretty similar Latin to Spanish. So some of those words are still being in Latin. So probably for those that speak Spanish, it's easier. Okay, that was an extra comment. Now, the important about these muscles is that these muscles, they are going to stabilize the pelvis and they are going to abduct the thigh. So what they're going to do? So those two, they're going to stabilize the pelvis, and also another function that these two, it is that they are going to abduct the thigh. Okay. Oops, sorry, I think I just skip abduct. Oh, okay. Let's just do something better here. Just trying to abduct the thigh. Now, yeah. So now I will show you the pictures. So here is the picture of the muscle that I was mentioning before. So here we have, for example, the gluteus maximus. It all is all this here. Okay. So this is the gluteus medius, which is here. Okay, so remember that those are located here in the pelvic area, which we can see here around. Okay, and those are going to innervate, and those are innervated by the superior gluteal nerve. Okay, and then one more picture here. It is this one, the gluteus medius. This is in the lateral view. Okay, this is lateral view. And this one was a anterior view. So anterior view here. Okay, but yeah, so in the lateral view, let's just come back to lateral view. We have the gluteus medius, which is here, and then we have your gluteus maximus, so we can see right there. And then we have the other one that is innervated by the superior gluteal nerve, which is the tensor, this one here, the tensor fasciae latae. So probably you're asking, but why are you mentioning all this if we were talking about the positive Trendelenburg sign? So to understand the positive Trendelenburg sign, it is important to have in mind that this nerve, the superior gluteal nerve, is going to innervate these three muscles: the gluteus medius, the gluteus maximus, and the tensor fasciae latae. Why? Because if one of those is injured, has an injury, so the patient is going to present this sign, which is the Trendelenburg sign. So what it is, this Trendelenburg sign? So here we have the normal gait, which is this one, and this is the normal gait here. Okay, and this is the Trendelenburg sign. This one, Trendelenburg sign, okay, positive. Here is a Trendelenburg sign is positive, okay. So now I want that you see how looks like the pelvic area in the normal gait in this patient, and how the patient that has injury of the superior gluteal nerve looks like in this case here. Do you see? Okay. So I want that you pay attention to this, and also here this is the normal, and this is the patient that has the injury of the nerve. Okay. Now the point with this, it is that there is going to be a weakness of the gluteus medius. So this gluteus medius that we can see here, this one is going to be weak. Okay, so it's going to be weak. Also the gluteus minimus, and then those that are the gluteus minimus that we can see right here, also this is going to be weak. Okay, so yeah, it should be weak. Yeah, so the gluteus minimus is weak, the gluteus medius is weak, and the tensor fasciae lata also, so not the tensor fasciae lata. So yeah, the gluteus medius and the gluteus minimus, they are going to be weak, and this is going to cause that the pelvis is going to sag. So basically it's like it's going to sink toward where? Toward the unaffected, so to the contralateral side. Okay, so but when the patient when the patient stands on the affected leg, so this gives you the positive Trendelenburg sign. Okay, so this one, so it is the positive Trendelenburg sign. So this is when the patient stands on the affected leg, is going to have the positive Trendelenburg sign. But the weakness of the gluteus minimus and the gluteus medius is going to cause that the pelvis sag toward the unaffected, so that means to the contralateral side. Okay, if the side is in the right side, so it's going to sag to the contralateral, which is going to be the left side, for example. But what about when the patient is walking? So when the patient is walking, so the patient will lean toward the affected, so that means ipsilateral side. So now we have two things here. So when you are walking, okay, let's just do it in blue as we continue with our pattern. So when the patient is walking, is going to be ipsilateral. Okay, but when the patient is stands, is going to be contralateral. Okay, and so but why it is ipsilateral when the patient is walking? So it is to compensate, because the hip, so it is to compensate because the hip drop. Okay, and now why the hip drop? Because for the gluteus medius. Okay, for the gluteus medius. Okay, for the gluteus medius lurch. Okay, so basically it cannot be stable, and then that's happened. Okay, this is in the ipsilateral. Now I think that probably will be enough to understand what does the patient has, and remember that all those things is more anatomy, so we just need to learn the basic things, and then we can just has a good success and overall. So we need to continue trusting God, because we can do all things through Christ who strengthens us. And thank you, and God bless.